What's up, y'all? It's Celeste, and first of all, I just want to make a little announcement, which is that I just crossed the 1,000 subscriber mark, and that's really awesome. I'm so excited. Thank you guys so much for following me and subscribing and supporting me and everything, because I really appreciate that. You guys are fantastic, and I'm really excited because, well, I would be excited anyway, but I was actually looking back at some of my older videos a couple of days ago, and I realized that it was March of last year, so 2017, that I crossed the 100 subscriber mark. So in less than a year since then, I've already multiplied that by 10. So that's kind of crazy, and I'm just really excited. So thank you guys so much for that. The second thing I want to draw attention to, which kind of segues into the video, is the fact that I'm wearing a tank top, which might not seem like kind of a big deal, but it is for me because I really haven't worn tank tops really hardly at all, pretty much since I was a teenager, pretty much since I developed a chest, and after that point I did wear them a little bit as a teenager and a little bit in college, but very rarely, and pretty much for the last 10 to 15 years, if I wore anything sleeveless, I always would wear a sweater or a hoodie or something over it just because I felt so uncomfortable with how I looked and felt in anything sleeveless with the way my chest was. And so now, look at this. I'm just I feel so totally comfortable wearing this. I don't feel like anything's I don't know. I really didn't like how it felt. Not only because of the part that actually was here, but I always had this extra tissue, and I felt really uncomfortable just with the whole way that tank tops fit before. And now I just feel it just looks like a normal t-shirt, and it's awesome. So I'm really excited about that. So anyway, that does segue into the topic of this video, which is that today, which is February 10th, is my 4-month post-op date, because I had double incision top surgery with Dr. Garramone on October 10th of 2017. So here is my update. I will, as usual, just go ahead, show you my chest, and then I'll come back and do the rest of my update. So here I am at 4 months post-op, and this side continues to be the flatter of the two, the smoother of the two. A little bit at the ends, you can feel a tiny bit of a ridge there, but it's very insignificant. And the center part is really smooth. I can barely even feel any difference in texture here from one side to the other, crossing over the actual incision there. On this side, it is a little bit thicker, as it has been all along, and I can feel a thickness under here of scar tissue. It kind of depends where you get along the scar, how thick it is. It kind of varies across the scar, but both ends are still the thickest parts. This end here, which has been a little bit of a dog ear, has definitely smoothed out some. It's still there. You can still kind of see it a little bit, but I think it's smoother than it was last month. So I think massaging has helped that, and has helped along the length of this scar. I'm actually not even really massaging this side really at all. Every once in a while I'll kind of go over it a little bit just to sort of soften it up a little bit, but basically I'm just doing this side because this side is the side that actually needs it. And this center part I am massaging every day, but it still is pretty thick here. I don't know if it's gotten better or not, but I do find that massaging it every day helps kind of keep it from getting harder and I don't know, tighter, because I went a few days without doing it, and when I went back to do it, I definitely could tell the difference. It was quite a bit more tender. It usually is pretty tender when I first start massaging it anyway, but it was quite a bit more tender and felt a lot harder than it had been. So I feel like doing it kind of ongoing really does help with the softness there. The nipple grafts are looking pretty good. Actually, right this second, they are a little bit kind of dry looking. That's just because I didn't put anything on them today. I usually put a little bit of the rosehip seed oil that I use to massage my scars on them every day, just after my shower, and I didn't do that today just because I wanted this video to be pretty much like my chest exactly as it is after I've taken a shower. But otherwise, they are healing really nicely. I feel like they look very natural at this point, and you really can hardly even see, or maybe can't even really see where they're stitched on. It's so kind of smooth and natural looking. So I'm really happy with those. Before I cut away from this shot, I'm going to do something that I've seen a couple other people do. The first one is Gabriel, I want to say Resendez. I'm sorry if I mispronounced your name. And then the other one is Ashton Daniel. And both of them have taken a Q-tip and used that to sort of illustrate the difference in sensation on the chest post-op. Because obviously if you're touching your skin with your own finger, then there's going to be some confusion about like what you're actually feeling where, whether you're feeling it in your chest or your fingers. So by using a Q-tip, you can kind of tell a little bit better. So I actually don't really feel like I have very much numbness anymore, very small amount. So we'll see how that actually works now that I'm using this Q-tip. But all along here, I can feel this really normally, just totally normally. And yep, all this feels pretty normal. Okay, right here, this area on both sides is the part that it's like I can feel it, but it definitely feels a little bit more towards the numb side where it's like a little bit dull, but a little bit tingly sort of, but not like really tingly, not like when your foot falls asleep or something like that. It's just a little bit, I don't know, just a little bit duller feeling, I guess, in this area. It's not so much on the outsides, maybe a little bit like right close in here, but like over here, this feels totally normal. Maybe a little bit here, but it's really mostly like up here. Actually, I think it's maybe a little bit more numb on this side, which is kind of interesting. Yeah, like right here, it's a little bit numb still. So basically just like around the areola areas, areola areas, and like right here. Pretty much. Everywhere else, I pretty much have pretty normal sensation. Like I can feel that I'm being touched here. It's not like real strong a feeling. It's not like sensitive or anything either. It's just kind of like touching your skin anywhere. Maybe a little bit more mild along the actual incision lines. But pretty much just normal sensation here. And then on the actual nipples themselves, again, they're a little bit dry right now, so that might be affecting things, but because I can feel kind of the sort of scraping feeling of going against dry skin. But I mean, I definitely can feel a sensation there, and if I use any kind of pressure, I can feel that pretty normally. So yeah, feeling like I have pretty much most of my sensation back. It's maybe actually a little bit, like if I push right here, it's a little bit, I don't want to say tender because it's not like a sore feeling. It's just maybe a little bit more sensitive right there, but not super, not like a lot, just a little bit. So basically this area is where it's a little bit numb, maybe a little bit under here, and that's pretty much it. Like everything else is pretty normal at this point. So once again, here is my chest at 4 months post-op. So most of the changes that I've had in the last month are probably a lot more subtle. Like as the healing goes on, I think the changes tend to become more subtle because the first few weeks is like the main like thrust of healing that's happening where you're starting out like looking really bad. So in the last month, I mean, there are changes that are visible, but they're pretty subtle, like I said, and it's more just everything's kind of getting smoother and flatter and just, I don't know, more healed, which is obviously what should be happening. So that's good. As far as pain, I haven't really been paying attention to it, but I actually can't really remember feeling too much pain in the last month. I mean, I must have like every once in a while, but I really don't feel like I've really had very much of that recently. I mean, I can't remember, so it must not have been too bad. And as far as motion, I still I'm able to do pretty much everything. Like I can feel a little bit of tightness when I do that, but it's not really very strong, and I don't know, it definitely feels like everything's just getting a little bit like looser and more stretchy. I don't know, like it doesn't feel as tight. It doesn't feel like I'm doing anything out of the ordinary by doing this as much as it did before. It's still a little bit, but not a whole lot there. I'm still not quite back up to where I was fitness-wise last summer, but I'm getting there. It's taking a little while, but I am like riding the bike every day. I'm riding the bike now for like 30 to 40 minutes, which is like, I'm increasing it as time goes on. And then with weight stuff, I Last summer, like at the peak of my fitness level, I was doing things with 20-pound weights, and now I'm actually now using 20-pound weights as of like the last like week or two. But I'm not actually able to do everything all the way, so like I will like do like as far up as I can go and then just like do all the reps, and then like eventually I'll work my way up to being able to do it all the way, because that's the exact same thing I did last summer, because I have 3-pound weights, 5-pound weights, and 20-pound weights, and instead of like going out and buying anything in between because I'm cheap, I'm just using the 20-pound weights and then just like not doing everything all the way and then working my way up. So I know it's going to work, but again, it's just taking a little bit of time. Still using the Mepitech tape on my incisions, and I am about to run out of the roll that I got. I'm trying to remember when exactly I got it. I should have looked. I know it was shortly before my 3-month update, because it was definitely in between the 2-month and 3-month updates. So I guess it lasted me, I don't know, a month and a half, maybe a month to a month, and probably a month and a half, because I still have a little bit left. And that's changing it pretty much every week. So that's how long it's lasted for me. But I did just order another roll of that, so I do plan to continue using that and wearing those for a while. I don't really have like a specific plan exactly of how long I'm gonna use that. It might be for like a year post-op. I doubt it would be longer than that. It just kind of depends like what I feel like I need, I guess. I think the effects that it's actually having on the incision, like scar healing, probably will run out after a certain length of time, but I know that it can be good to just keep your scars covered from getting sunlight and things like that too. So I don't know, it seems like it could be a good idea, but it might get to a point where I feel like I don't really need to do it anymore, so we'll just see about that. I think that's pretty much all of the updates that I have. Again, not a whole lot to report, which is good. Things are still continuing to heal. I do still have that area in the middle, but I'm kind of working on it and kind of just hoping the time will continue to heal it and soften it. And other than that, that's about it. So as always, if you have any questions, please leave them in the comments or message me. I did want to note that I have been getting a decent amount of DMs on Instagram in the last couple of months, and I've been trying to get better about this, but because of the way Instagram works, for some reason it doesn't really alert you when you have DMs from people that you're not already friends with, and it's kind of stupid, but like a lot of times I won't even know that I've gotten messages until I like go in there, because I am alerted that somebody I am friends with has messaged me, and then I realize there are like 4 message requests from people that I didn't know about. And so I'm trying to get better about checking it now that I've realized that that's happening. But if I don't respond to you right away, that's why it's not. I'm not trying to ignore you. I just like literally forgot to look at my DMs because I'm just not used to doing that yet. But I'm trying to get better about it. If you like this video, give it a thumbs up and subscribe to see more of my future content. And you might also want to click that notification bell icon, because for some reason YouTube doesn't always alert you when there's new videos from people you're subscribed to, because YouTube. But yeah, you might want to do that if you want to make sure you don't miss anything that I put out. So other than that, thank you guys so much for watching, and I'll see you next time.